Hello, I am Sensei George, a first year second semester student at Morgan State University. Today, I will discuss the importance of the LGBTQ community and substance abuse. People often use drugs and alcohol to cope with stress or emotional pain, escape from problems, or gain acceptance. Although anyone can become addicted, certain people are at greater risk, including lesbian, gay, bisexual, and transgender individuals. According to the National Association for Alcoholism and Drug Abuse Counselors, 30% of the LGBTQ community struggles with some form of addiction. Combining alcohol, substances, and tobacco, addiction is 2 to 4 times higher in the LGBTQ community than that of the general population. The Center for American Progress released an article titled Why the Gay and Transgender Population Experiences Higher Rates of Substance Abuse, included 3 main factors that contribute to these higher rates of substance abuse in the gay and transgender population. The first factor is minority stress that comes from social prejudice and discriminatory laws in everyday life, such as employment, relationship recognition, and healthcare. Second, the lack of cultural competency in the healthcare system not only discourages gay and transgender individuals from seeking treatment, but can lead to inappropriate or irrelevant service. Finally, targeted marketing by alcohol and tobacco companies are exploiting the fact that bars and clubs are not only safe spaces for socialization for gay and transgender individuals, but provide easy access to tobacco products and alcohol. As a result, gay and transgender people turn to tobacco, alcohol, and other substances as a way to cope with the challenges.
Hi, my name's Tia Brooks, and I'm a LGSW, currently working as a therapist at a residential treatment facility in Baltimore. First and foremost, what we know in terms of statistics is that LGBTQ youth are more likely to be bullied, assaulted, kicked out of their homes, judged, and so on and so forth, which actually puts them at a higher risk to engage in riskier behaviors. So what we know in terms of research, or at least how I've digested it, is that, as these kids struggle with their identity issues, there's that, and whatever else may be going on in the family and so on and so forth, there's that need to almost self-medicate. In terms of treatment, I feel like it's important to, like any therapeutic relationship, begin with building rapport, being empathetic towards the client, and eventually identifying the root causes of the substance abuse, while also solidifying the potential issues they may be having in terms of their identity or where they are in being authentic towards themselves. What that might look like in the beginning is a lot of psychoeducation and a lot of validation towards the client, kind of using statistics and showing them that, almost normalizing it for them, not the behavior they're engaging in, but the fact that there are others like them, and that in this specific area, in this room where you're having this therapeutic relationship and alliance, that there is no judgment. This is a judgment-free zone. This is normal. Kids like you go through this. That way they build more comfort and more trust with the person that they're having to see potentially weekly regarding their substance abuse issues, be it alcoholism or harsher drugs. As time goes on, I think it's important to create a timeline. The client going back maybe a year prior to the substance abuse starting, and then up until the present, and what they hope for in the next year. That way you're identifying what was going on before I started smoking, drinking, etc. What happened that triggered the issues, and then where do I actually want to be? Is my thought that I will be done with this and solidify my identity and so on and so forth. So a lot of it really is just a lot of self-work, and it's a lot of self-identification, and it's a lot of walking them through what's internally happening to them so that they can move past how they medicate themselves. That's how I would do it. That's my opinion based on things that I've read and my treatment of some LGBTQ kids with substance abuse issues.
Treatment for an LGBT individual is the same as that for others who are dealing with substance abuse. The Substance Abuse Mental Health Services Administration indicates that the LGBTQ substance abuser should be assessed to determine the range of services and levels of care they require. Knowledge of the type and amount of a drug used by a client, the danger of a medically complicated withdrawal, the difficulty of the withdrawal, and the impact of social and psychological stressors helps a counselor determine the level of care a client needs. Whatever the planned treatment, the level of care should match the client's needs. The LGBTQ community lacks access to effective treatment. Those who identify or consider gay or lesbian are twice as likely to be uninsured as heterosexuals, and the number is higher for adults who identify as bisexual or transgender. In regards to drug treatment, finding treatment centers that have programming specifically geared towards the LGBTQ population is paramount.
My name is Heather. I'm 31 years old and I am a recovering heroin addict. Let's see, where do I start? I had a pretty tragic upbringing, was in and out of group homes. I started using when I was probably about, I'd say 14 years old, smoking pot. And when I was 15, I came out. The two didn't go hand in hand, or I didn't think they did. In my 20s, I experimented a lot with pills and ecstasy, alcohol, and things of that nature. My addiction really didn't progress until about a year and a half ago when I ended my 10-year relationship with my partner. In that time, I started to use heroin intravenously and also started sleeping with men. The last 2 years have been pretty insane, in and out of treatments, dealing with being a straight woman or bisexual or whatever it is you want to call me, dealing with the loss of my partner and, who's now getting married to another woman, which is insane, but I really struggled, and, through having a good family and lots of support, I've been able to get myself back together and get myself clean. I'm still struggling. I probably have about maybe 3 months under my belt since I last used. But, I never thought that, maybe being gay and drugs went hand in hand, but I definitely, when I started sleeping with men, I feel like I went through a shift in my life emotionally, because maybe some things from my past and, things with the breakup, it was a lot. But here I am, clean and sober, and taking it day by day.
There are a number of steps that can be taken in order to reduce drug and alcohol addiction in the LGBTQ community. In order for these changes to truly be effective, they need to be created and implemented at the national level. Increasing our understanding of treatment outcomes for LGBTQ substance abusers is especially important since research has demonstrated that LGBTQ clients enter treatment with more severe substance abuse problems than heterosexual clients. Only 6 treatment outcome studies of LGBTQ substance abusers have been published recently. None of these studies have included lesbian, bisexual women. Most have focused on drug use disorders. Only of them used a comparison sample that received treatment of similar length and type. With the lack of data collected in the LGBT community concerning substance abuse, it is difficult to figure out which program would best suit this population. A practice that would be effective with the LGBT community is the GAP model. The Gay Affirmative Practice provides a self-assessment tool to measure a clinician's belief. There are several questions about substance abuse in the LGBT community that remain unanswered by the available research. Reducing rates of substance abuse in the gay and transgender population require both a short and long-term strategy. Service providers should be competent and knowledgeable about the LGBTQ community before they assist them in treatment. They should also be willing to link them to programs that will be able to assist them to get the treatment that they need for their substance abuse. On a national level, there should be policies and procedures implemented to help those individuals in the community to be able to afford the treatment that they deserve. With the help from the Human Rights Campaign, individuals in the LGBTQ community will continue to fight to receive specialized treatments for substance abuse.